risk mitigation and female PED use. The truth that nobody talks about with PEDs is that PEDs are not the same in women as they are in men. The two most critical variables about female PED usage is the dose and the duration. Almost all compounds can be used by women safely. However, the side piece there is that the dosage needed to make sure that side effects are kept at bay in a lot of PEDs will actually not benefit you and offer any reward. So with that, we need to think about the compounds that we can use and keep in mind the duration of use and the dosage we are using. So in short, just because you can take something doesn't mean you should take something. The biggest risk with female PED usage is, of course, virilization. Now, what does virilization look like? Deepening of the voice, clitoral enlargement, menstrual cycle issues, male pattern baldness, male hair growth. All of these things combined are risks you are taking as a female when you are running androgenic or anabolic steroids. The best PEDs for females to use are going to be those which have low androgenic activity, short half-lives, and clear exit pathways. Some of my personal favorite PEDs for a female to use are going to be low-dose testosterone, growth hormone, primobolan at a low dose, and Anavar at a low dose. Now, are there other drugs? Of course. Females can get away with using NPP. They can get away with using turinabol. There's a lot of drugs, like I said earlier, that females can use, but dose and duration, incredibly important. So, low dose. Now, in terms of female duration of a cycle, I'm a firm believer that the shorter the better. So we're looking at, a female, in my opinion, shouldn't necessarily run PED cycles longer than 6 to 8 weeks max, whereas in a male, you can look at 12, 16, 20-week cycles, no problem. In a female, you cannot do this. The longer you run a cycle, the higher the risk of virilization. Now, when it comes to dosages, obviously drug-dependent, dosages are going to vary, but a safe way to look at this, 5 milligrams a day, 2.5 milligrams a day Anavar equates to roughly 30, 35 milligrams a week. You look at something like primobolan, again, 30 milligrams a week, a very low dose, not going to be super virilizing in most women. Now, does that mean you're not going to have any side effects? Absolutely not. You're going to want to pay attention and change your dose if you start to notice these things, because once they're there, a lot of the times they are irreversible. Tren, D-bol, Anadrol, Equipoise, all of these drugs just have way more risk for a female, and to be honest, they just should be avoided because the risk is way higher than the reward, and any dose you take to minimize that risk will offer no reward, and there's other drugs you could use in place that will have a higher reward with a lower risk ratio.